Effective communication is paramount to providing excellent diagnostic care. And meeting patients where they are in terms of language preference is important in order for them to understand the diagnostic process as well as the treatment. My goal for the Scholars program was to improve access to language resources for patients with a non-English preferred language. There are about 50,000 PubMed research articles on digital health technology and as well as language or interpreter services, but less than 1% are on the patient perspective. And so my thought was that AI is really moving along in the healthcare system. Healthcare systems are adapting a lot of technologies, but they're not getting the patient's perspective and how they want to receive this technology and use it. And so we focus on Spanish-speaking individuals because our team speaks Spanish, but our goal is to expand to 6 or 7 of the top languages within Boston, which is where we're located. So my patient community were surgical patients that needed either surgery or had surgery, and we were working with our patient and community advisory board to identify those who are specifically Spanish speaking so we can engage them on how to use these different language access tools. One tool was a mobile app, another was an iPad that provided a medical interpreter, another was an AI-based solution. So we asked them, of these options, which one would you prefer? We did our own vetting beforehand just to make sure that the tools were high fidelity and that they were really good tools before we gave them to the patient, but we really wanted the patients to drive the conversation around which one would be best. Patients have really asked for more control over how they engage with technology or interpreter services. Historically, addressing some of the inequities within our healthcare system has been a relatively slow process. I think that technology could really help us accelerate some of the how we implement the tools and how we test them, but also get them to the patients who need them most. The next steps for the project are we are recruiting more patients because we're getting a sense that there's a difference in health literacy for all of the patients and there's a difference in English proficiency, and where we think that patients may have a preference for AI versus an in-person interpreter versus a mobile app interpreter. And so we're trying to delve more into what is happening there. And then ultimately we want to create a toolkit that we could use for other healthcare systems as to what are best practices for implementing technology in interpreter services. Effective communication is critical for excellent diagnostic care and treatment for our patients. And for those with a non-English primary language, it is really important that we provide these interpreter resources, whether it be an AI-based technology, mobile app, or in-person interpreter, but that will allow them to really have, again, effective communication leading to better health outcomes. And ultimately, it improves communication for all patients.